The information shared on CNS Unfiltered is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Always consult your healthcare provider before making any health or lifestyle changes. The views shared are those of guests and do not necessarily reflect those of Innate Clinical Nutrition or its affiliates. This episode includes affiliate links, which help support the show. Hello and welcome. I am Jena Salisbury, and this is CNS Unfiltered, a show where clinical nutrition specialists uncover what traditional medicine overlooks. As I've said before several times already on this show, CNS practitioners see patients when they're at the end of their rope. They've talked to everyone about the symptoms they're living with in their bodies, whether that's chronic skin concerns like acne or eczema, or inflammation in the body, or gut and bowel problems, or energy, or sleep issues, really, you name it. And they found no answers that work long term. They've been told no one knows what's wrong with them. Or sometimes, even worse, nothing is wrong with them. And yet, symptoms persist, making it exhausting or impossible to show up in their lives the way they want, to continue to connect with those around them, to experience joy or relaxation. What makes functional medicine such a rewarding and fulfilling field to work in is the level of connection that we can have with our clients. Part of what makes that possible is that so many of us started practicing because we were the patients. We were in their shoes at one point. So many CNS practitioners that I've met over my 15 years of practicing functional medicine were those patients at the end of their rope at one point in their lives. A lot of us are intimately familiar with the frustration and pain of endless doctor or specialist appointments that lead nowhere, of missing out on important things in our lives, and feeling like no one really hears us. And at the end of it all, of managing symptoms that start to feel like permanent parts of us because we can't get answers. Those experiences are what drive so many CNS practitioners to the field in the first place. And it's those experiences that make it so much easier to connect with people who walk through our doors and to truly see them where they're at and to know what they need. We can feel frustration, we can feel their stress, but when we find the answers together, we can also feel their joy and their resilience. Today, I'm speaking with Sara Kahn, owner of Bliss Nutrition in New York. We'll discuss how her own health struggles led her to her career as a CNS. And of course, we'll discuss a case study with one of her former clients, a retired physician, an avid world traveler who was able to finally get relief in her gut after finding Sara and exploring pathways beyond traditional medicine. Hello, everybody. Welcome to CNS Unfiltered. Today, we have Sara Kahn. She is the founder of Bliss Nutrition. We are so lucky to have you today. Thank you so much for joining us.
Hi, Jena. Thrilled to be here.
So Sara is going to take over and tell us about her CNS journey, how she got to where she is, her practice, her passion. So I'm going to turn it over to her. And then, as always, we will jump into a case.
Sure. So, like many of us CNSs, we come to this practice having experienced our own health issues or health issues of loved ones, family members, and my situation was no different in the sense that, I had been dealing with a lot of digestive issues in the past. And a friend of mine who was a registered dietitian, and this is oh my gosh, like maybe 10, 12 years ago. She recommended a new dietary approach that not many people had heard of, and that was the low FODMAP diet. That was a number of years ago. But, like a lot of our clients, I had seen a lot of doctors, been dismissed, and, oh, it's just IBS. And that was kind of the end of the conversation. Like there was nothing else to do. And my friend, who was a registered dietitian, she's like, well, maybe you could try this. She didn't even know. And so at the time, it was literally like a handout and it, eliminated all of my favorite foods. At the time, I was a vegetarian. So no beans, no guacamole, you know, pizza, like no wheat, garlic and onions, forget it. So it was helpful, but it was also devastating at the same time. And I had to like completely, rework my diet. And it was a real struggle. Like I'm based in New York and I live in the food capital of the world. So going out to eat, socializing, holidays, all of that was like really tough. And so I just come to this having experienced the good and the bad. I've experienced how diet and lifestyle can really have a positive impact. And the flip side of that is, hey, this really sucks. This is not easy. And granted, this was, so many years ago where there was virtually no support for this type of dietary change. Now it's quite a bit different. Anyway, that I was in the midst of my first career, which was in marketing. And, once I had this kind of turnaround with my health and experienced the changes that I did through diet and lifestyle, I wanted to be more informed and did a deep dive as much as I could as a non-professional and wanted to learn more. And I was also at a crossroads with my first career and decided, I really want to do something much more fulfilling. I was actually working for specialty foods like cookies. It was great in the sense that I love food, but I couldn't even eat it. I couldn't even enjoy it. So, anyway, long story short, I decided to go back to school and I went to, at the time, what was Maryland University of Integrated Health. Um, and I decided to go down the CNS path after talking to my friend who is an RD and hearing about her education and her path. And for me, working in an institution, working at a hospital or food service, like that just wasn't of interest to me. Not to say that those aren't important and interesting jobs, and there's a huge need for support in those facilities. But it just wasn't like that's not where I saw myself. I wanted to work more one on one with people. And even then, I knew I wanted to work with people who had digestive issues, just something that I could immediately relate to. So I went back to graduate school, got my master's in nutrition. And because I am based in New York, where it's the wild, wild west in terms of legal structure, I just started practicing rather immediately and eventually got my New York has a CDN, which is Certificate of Dietitian Nutritionist. Um, and 7, 8 years later, here I am. Very quickly was booked, kind of maxed out seeing clients. I brought in another clinician who's based in California, Stacy. Shout out to Stacy. And we've together, have been working together for a number of years now and eventually brought in another clinician, Ellen. Shout out to Ellen. So there are now 3 of us at Belly Bliss Nutrition, and we all specialize in digestive health. And then each of us have, subspecialties. And it's been tremendously rewarding working with a team, but also helping clients feel better. And of course, like with every clinician, our approach has evolved over the years. So that's where we are now, and I'm working on developing courses for clinicians to earn continuing education units on how to develop protocols. Whether you have a simple client or a super complex client, it's the same approach no matter what. Of course, the quote recipe will change. We do personalized nutrition, but how we think through cases, how we get started, it's the same. And we tend to have extremely complex cases. No one walks in the door with just digestive issues. We tend to see the clients who have failed other clinicians, other practitioners. They've also seen a lot of doctors. They come to us with a lot of mystery sort of conditions and illnesses. And our goal is to help them obviously feel better and live a more normal life. And we want them to eventually be on the broadest diet possible with the fewest symptoms. So that is our goal. That is our mission. And we want to get there in a way that is doable. It's doable. It's, look, everybody's stressed and overwhelmed with life. Like, I know personally how much diet and lifestyle changes can be really challenging. So we want to do this in a way that takes the overwhelm out of it.
Yeah, when there's a method to the madness and you know the system to run through, it really does take a huge weight off of the client's chest too, right? Because they have seen every doctor. And
Yep.
it's like, all right,
Like,
so
I give
let's
up.
work
I
through
don't know
it.
what to do. Yep.
Yep,
And it's
let's work
also
through.
less stressful for the clinician.
Well, yeah, yeah.
I
Well, you're not
right.
guessing, right? So I
Well,
think it's
you
always,
also know where to start, and the road and the path will change, but you know where to begin, and you can kind of cut out all the noise, and you know that this approach is gonna help them feel better in literally, like, 2 to 3 weeks.
yep,
Are they going to be completely resolved? No, of
nope.
course not. But you can sort of shepherd them through this path, and it really helps, like, me as a clinician. Like, I don't get so worked up over, "Oh my gosh, they have this condition that I've never heard of. I have to go do 10 hours of research now to," like, I don't. Like like, I'll learn eventually, like, what's going on, but that's not required to get started. So there's a lot less overwhelm, there's a lot less effort, and all the work that you do before your case even begins, like, that kinda just melts away when you have the right tools in the toolbox and the approach to your case.
So true. So true. Well, I can't wait to kind of deep dive more. So I know you brought a specific case for us. So I am excited to hear, who do we get to learn about today?
Well, I have a really interesting client in the sense that she is a retired physician. And, for those of us who work with other health professionals, it can be really, they can be challenging. But she was very open, and she also had her own interesting health journey where she had seen gastroenterologists and other allopathic um, doctors, and just got to a certain point. Like, she took it as far as it could go, and she knew that dietary approach could help her. So my client was a 69-year-old female, a retired physician who was now and is a caregiver for her 4-year-old grandson. And her chief complaints were diarrhea, gas, bloating. Because she was retired, she did a lot of, international and long haul travel, which really upended her digestion. So she would kind of swing from like diarrhea to constipation, especially when traveling, across the country or internationally. She was having daily bowel movements, type 4, type 5 on the Bristol stool chart. And then other concerns were, once the GI symptoms resolved, she wanted to work on improving her lipid profile and preventing dementia.
I would really love to know where traditional medicine left off.
Right. Well, she had, colonoscopy, endoscopy, and was diagnosed with IBS. Yeah. So it wasn't a very thorough workup. Her doctor did not explore SIBO or other um, types of functional gastroenterology type conditions.
Yeah, which they really don't go into the bacteria. It's
N-
wild.
It's changing. That is changing. I would say when I first started practicing back in 2017, like SIBO was just kind of coming onto the scene. Um, in fact, my IBS was eventually diagnosed as SIBO. And, I was treated for SIBO, and then that SIBO treatment actually caused a number of other issues. So it was kind of like whack-a-mole for a while for me personally. But that is changing. There are a lot more gastroenterologists that are becoming well versed in SIBO, and there's a lot of controversy around it as well. But
Totally.
that's a tangent we can save for another discussion or later in the discussion. So, she had seen her gastroenterologist a while ago and, had the endoscopy, colonoscopy, and I think at the time she had reflux. So she was put on a PPI, proton pump inhibitor, for a number of years, which we know that it really is a short term solution that should be like 6 to 8 weeks max. And she was just kind of left on it. And that was, a part of her, what I consider relevant health history, which also included history of potential traveler's diarrhea, which she experienced on a safari in Africa. So that would have been a big clue, at least. Hey, let's check for parasites. But she wasn't. She had a hip replacement and was also using antibiotics long term with that procedure. She also had a period of acute stress and anxiety that really improved with Lexapro. Now, what's interesting is because she's a doctor and she's done her own research here, she suspected that she had SIBO. And instead of testing, she self prescribed Flagyl, which is also metronidazole, on 2 occasions within the last couple of years. And what's interesting is that each round of antibiotics, it did help for a short period of time. But what she may not have known was that that was not the appropriate pharmaceutical intervention for SIBO. So it might have helped. It might have given her some relief for a short amount of time, but then it did return. She was also on the low FODMAP diet for years, but she found it hard to comply with, of course, like it is. So she would be kind of on it and then off of it and on it. And then a lot of clients say, like, well, I was on it, it was too hard, I cheated. I'm like, no, we don't use that word to describe going off plan, being on plan. It's just has such a negative connotation. It is a limiting diet and it is hard to implement. So really should not be any shame around not being able to be on a diet that is supposed to be short term. Yeah. She also had long-term statin use. She had high cholesterol or has high cholesterol and had been on statins for a while. And then her family history, both on her mother and father's side of family, they did have dementia. So that was where, wanting to prevent dementia as much as possible came into play. She had seen how devastating that illness can be. So that was her, what I consider the relevant health history.
Perfect. So, where traditional medicine left off was limited testing and they didn't think down the bacterial pathway, even when there were clues of her safaring and it all starting in Africa. Guessing, right? The self-prescribed, not using testing, because all the bacteria, they have a method to their own madness as far as evading the immune system or evading, the pharmaceuticals, which really can even put you in a worse spot than you started. So how does she find you, and what testing did you do? Like, how did you uncover where you had to go next?
Sure. Well, the relevant health history is important. Obviously, there were a lot of clues that there could be something bacterial, that there could be dysbiosis. We have the history of traveler's diarrhea. We have long-term use of antibiotics. We have that period of acute stress, which we know stress could absolutely alter digestive function. It can lower stomach acid. Acute stress can impact the gut microbiome. Um, the low FODMAP diet can absolutely impact the gut microbiome in a negative way. It can cause what I consider to be depletion, and then also being on, PPIs for long term can impact digestive function as well. Obviously, it lowers stomach acid, and there's some controversy about whether that is or isn't a risk factor in SIBO, but she's had a lot of risk factors for SIBO and dysbiosis. So that's where I was heading with this. But also, there were like the dietary patterns. And so I don't always start with testing, but I also really am interested in like what are they eating and how are they feeling? And is are there any modifications we can make immediately to the diet? So what we saw before we even got started, so this is like looking at her intake forms and her I have everyone keep a 3-day food journal, and of course during the initial consult, we're talking through all of this as well. But she had a high intake of lactose free dairy, even though she suspects it could be causing symptoms. So, what I love about our clients is so many of them really do know what's driving their symptoms. They actually tell you. Like, there's not a whole lot of guessing that needs to happen, but they're so unsure of themselves. And they've been through so much that they're like, well, I have a lot of dairy. I think it's causing issues, but I don't know. So I hear that a lot. And those are clues. Those are clues that we should be paying attention to. Also, despite having, reflux in the past, she was drinking coffee every day. She was drinking alcohol, at least weekly. And she reported symptoms with a number of foods, lactose and lactose free dairy, honey, non nutritive sweeteners. So that is, like stevia and monk fruit. And even though those are supposed to be like gut friendly, they aren't necessarily. Stone fruit, garlic, onions, beans. So here she was naming off lots of FODMAPs, and she had been on, a low FODMAP diet off and on for years. So clearly, even on a low FODMAP diet, she's still having quite a few symptoms. And this was a really good clue, is she would have diarrhea and gas with larger meals that also included alcohol and dessert. And, we dug a little deeper into that. And these larger meals were usually restaurant meals that were typically high in fat, along with the alcohol. And they also were high in histamines. So at that time, it was like, okay, we need to kind of parse out, like, is it because the meal was large and it's just hard to digest? And larger meals tend to make everyone, even people who don't have digestive issues, like to feel kind of like they overdid it and they're overfull and they're bloated and feeling kind of miserable. Or was it the alcohol, or was it the histamine content? So that was like, okay, we need to eventually kind of tease that out. And she was also eating lots of salads. And even though she was eating lots of salads, her overall fiber intake was relatively low. She also lives alone. and she was cooking for one, even though she was the caretaker for her grandson. She did live in her own space and she would have meals by herself. And she thought cooking for one was really time consuming and kind of cumbersome. And so she relied on a lot of quick and easy solutions like salads, eggs, cheese, yogurt, crackers, nuts, just things that are quick and she doesn't have to spend a lot of time cooking. And then we also looked at her medications and supplements. So she's taking Lexapro for anxiety, she's taking statin for high cholesterol, she was taking psyllium husk, FODMAPE enzymes. So she was also taking enzymes to help her tolerate higher FODMAP foods, which clearly wasn't working. She was taking lactate as well. And she was also on Prilosec for reflux up until like 2 months prior to our start together. So, between the health history and her dietary patterns, there was a lot that we could do and a lot to sort of tease out.
Perfect. And so you started with changing the diet? Did you jump right into supplementation? How was your next approach? What do you think was the turning point for this client?
So, the first thing we did during the intake, we discussed, and she suspected that she had SIBO anyway. That was something that we could implement kind of quickly because there's a prep diet and there's some waiting time for the test results. So, we knew that a SIBO breath test was going to be a practical one, initial step here. And she was also interested in doing a stool test as well and to kind of understand at least, the bigger picture of like, is she experiencing overgrowth? Is she experiencing depletion? Was there anything else going on? I was particularly concerned about possible fat maldigestion. So she quickly agreed that ordering those tests made a lot of sense, especially because the endoscopy and colonoscopy was unremarkable. But in terms of interventions, and this is again the approach that I use for all clients, I call it the pyramid scheme, right? So it's a pyramid shape, and we always start sort of at the bottom. We want to, make sure that our protocols are simple and doable and effective. And we want to ensure that she's improving digestive function. Like, that's really the first thing that we want to do because, we can have like the most effective gut health protocol, but it's not going to work if she's not doing the basics. And that's where we started. But the basics for her can be really complicated for somebody else, or the basics for her could be like super simple for somebody else. So you have to discuss the approach with your client so everybody's on board with what makes sense for them. So, where we started with her was again, I'm going back to what my client's telling me. She's telling me that she suspects dairy is an issue. So, she was open to eliminating dairy. And so we talked through what kind of swaps that we could make for the current dairy products that she's having. So, I think at the time she was having milk in her coffee. And so we talked about non dairy options. She's eating a lot of cheese and yogurt. So we talked about different replacements for those foods. And she was open to trying it for 2 to 3 weeks. In most clients, if you're eliminating food like that, you will see results. We're looking for a signal. Like, are you seeing some improvements within 2 to 3 weeks? If yes, great. If no, all right, it might be something else. Again, not to say that everything's going to be resolved in 2 to 3 weeks, but
You do start seeing changes in 2 to 3 weeks.
especially with like lactose intolerance. Like that resolves or improves pretty quickly. Um, and then we really wanted to focus on improving digestive function. So what does that mean? Well, we want to incorporate foods and practices that will help support stomach acid production, bile flow, enzyme production, etc. So she's already eating salads. So, we talked about, okay, can we add some bitter greens to these salads? Can we try having cooked vegetables more often? And could these bitter greens like arugula or bok choy, kale, Swiss chard, radicchio, etc. Like all of these bitter greens can be really helpful for stimulating digestive juices. And she was totally open to that. And then we wanted to increase her fiber intake without making gas and bloating worse. So we wanted to really focus on adding in the higher fiber, low FODMAP foods. So that can help improve stool quality without provoking the gas and bloating. So we looked at oatmeal, we looked at ground flax seeds, we looked at berries and kiwi, pumpkin seeds, eggplant, etc. Constipation was a big problem for her with a lot of the traveling, even though she would have these like flares of diarrhea. But really, like what sort of the common thread throughout every symptom was really the gas and bloating. And I find that if you're constipated, that's going to make you more bloated and more gassy. So the key to resolving gas and bloating, a huge part of it is just having normal bowel movements. So that was really where we started with her. And so this is simple, this is doable, for her. Since FODMAPE, that digestive enzyme for FODMAP foods, wasn't really helping, I suspected that she was experiencing fat maldigestion. So I recommended a trial of, a more broad spectrum enzyme that could help digest carbs and protein, but also fat. And FODMAPE doesn't have a fat, it doesn't have lipase in it. Um, and I will also say that we did this over the course of maybe a month. So this wasn't all like, okay, now she's doing all of these things just on day one, but this was sort of a gradual sort of layering in of steps. We also replaced the psyllium husk with sun fiber,
Mhm.
which is partially hydrolyzed guar gum. I tend to see psyllium cause bloating in those who have SIBO or other dysbiosis type of situations. So we tried sun fiber, which is a low FODMAP type of fiber, and it's generally well tolerated. So those were a few of the first things that we tried. She also, again, had some travel, long haul travel planned during these times, and she was really concerned about the constipation that she experiences. So there was some education around how to prevent constipation while traveling. And again, just gave her some tools in her toolbox. So bring the sun fiber, bring some magnesium citrate, stay really well hydrated. Consider bringing electrolytes with you, especially, to trips overseas, where you're going to be in this very dehydrating situation for for a few hours. And that really helped as well. So
Awesome.
that's where we started, I would say, over the course of 4 to 6 weeks until we got all of our test results back.
So, when it comes to the test results, did she end up doing both? Did she end up going to the physician for the breath test of SIBO and doing a stool test? And if so, what stool test do you do?
She did not. She actually lives in 2 states. And so her doctors, her practitioners were in her home state. So it wasn't practical for her to go see her doctor, and she was open to having me order these tests with the caveat of, hey, if anything shows up that requires you to see your gastroenterologist, then, of course, I will recommend you see your doctor. So we ordered a Trio Smart SIBO breath test, and I ordered GI map stool tests. So we ordered both right around the same time. And yeah, she was very interested to see what was going on behind the scenes.
Awesome. Can you let us in just a little bit?
Yeah, yeah, of course. So within the 4 weeks, so within that like 4 to 6 week time frame, even before we had test results, I just want to emphasize that we don't have to have test results to get started. Of course, the test results can help us fine tune, but within those 4 weeks, 4 to 6 weeks, her gas and her stool quality really had improved, even with the traveling. So we did receive the GI map and the Trio Smart results. The relevant findings with the GI map showed high H. pylori, high steatocrit, which is that marker of fat maldigestion. She had less than optimal pancreatic elastase, which is a marker of pancreatic enzyme sufficiency, and low secretory IgA, which is a marker of gut immune health. And the Trio Smart, which is the SIBO breath test, showed methane overgrowth. So there was a lot going on under the hood, so to speak. A lot of reasons for feeling gas, bloating, flares of diarrhea, bouts of constipation. It may or may not explain her recent history of reflux and GERD. So we had a lot of potential answers there.
I do have a burning question now that you said that. With all of the progression that was made over that first 4 weeks, were you using a probiotic? Because that's the first thing everyone's going to do is go grab a probiotic. And we know that could even make things worse sometimes in these situations. So we hear the dietary changes that you had made listening to the client. Did you add any supplementation in for that correction also in that first month, or did you wait on supplementation till you had more test findings?
Right. So she was already using some supplements. And so what we wanted to change out was the FODMAPE because she was still experiencing symptoms with high and low FODMAP foods, regardless of using FODMAPE. And that's when I suspected, like, all right, this is beyond a FODMAP issue. So we swapped that for a more broad spectrum enzyme formula that can help digest fat, protein, carbs, and not just FODMAPs. She was also taking psyllium husk. And so we swapped that for the sun fiber, the PHGG. It's just better tolerated. And I feel like sun fiber is like a wonder fiber because it can do so much. And if I do suspect SIBO or methane overgrowth or EMO, as it is now called, I usually want clients to start sun fiber early in the game because studies have shown that treatment plus sun fiber equals better efficacy. And we're talking about the difference of, I think it was like rifaximin alone is a 50% efficacy rate, but rifaximin with PHGG was 80% efficacy rate. Like, that's huge. And it's well tolerated. So, Sunfiber can help with making treatment more effective. It can help improve stool quality, whether it's diarrhea or constipation. It can help lower methane. In this case, after the fact, we learned that she had methane overgrowth, but in general, it can help lower methane. And it's a prebiotic, so it helps encourage the growth of the good gut bacteria. So most of my clients do really well on it. I like using it, especially if we're going to be heading into some sort of treatment protocol, whether it's with me or with their doctor. Having that on board can be really helpful.
Awesome.
Yeah.
Awesome. So it sounds like just those changes were done with supplementation and the rest was food first. Am I gathering that
Yes,
correctly?
so we did not start with a probiotic. I rarely start with probiotics because probiotics don't necessarily improve digestive function.
Exactly.
So we kind of have to go back to that pyramid scheme, right? And the base of the pyramid is improving digestive function. And now, if there is a specific reason for using a probiotic, which we later have those reasons once we get some more intel, through our test results. But in some cases, if a client has post infectious IBS or antibiotic associated IBS, meaning like they just took an antibiotic and now they're experiencing diarrhea, then yes, of course, like
Yep.
probiotic can be helpful. It's been studied, certain strains have been studied to help with those particular conditions. But when someone comes in with long term GI issues, the probiotics are not the first thing I think of. And they're really kind of hit or miss. And that's what I tell my clients is like, they may help, they may not help. I don't know. Like, we can try one, but it's not the first thing that I would recommend. And many clients come in already having tried a bunch of probiotics. And my question is like, okay, did it help? And they don't know. And if they say, yes, it helps, great, keep it
Yep.
in. Like, fantastic. But in most cases, they don't. They don't know if it's helping or not helping. In some cases, if they're taking a probiotic and they don't know if it's helping, I just have them stop for a month. And I was like, okay, well, let's see. Like, was it helping? If it was, great. Just start taking it. Like, it doesn't have to be that complicated. Uh, but it is very hit or miss. And we like using strains that have been specifically studied to help improve very specific outcomes. So we're not just grabbing a probiotic, any probiotic off the shelf. We're using probiotics that have been studied for very specific things.
I love this. And thank you for kind of deep diving into that because I see that in my practice also. Everything that you just listed. And it's like, wow, probiotics, they're living organisms. Like we have to know we're putting living organisms that change biochemistry in your body. And is it working? Is it not working? But also just having that understanding of what we're trying to do. I think a lot of times clients are like, okay, my doctor told me to get on a probiotic, right? I said I have gut issues and they say a probiotic. So I'm with you. Probiotics are not the first thing I think of either. But it is for a physician or for a client, right? So thanks for breaking that down for anyone listening who jumps to the probiotics to think through that a little bit more clinically. So for all of the listeners right now, because I'm sure they're burning to know if you're willing to tell, what are the layers of your pyramid?
So every client's going to be different, right? But the bottom layer is the foundation. So that could be improving digestive function. It could be, improving the stress response. It could be working on sleep. So it kind of depends on, what else is going on in the client's life that is really impacting their symptoms. And I would say for most of my client base, stress and overwhelm is a huge part of, the mediators, both the antecedents, the mediators, and the triggers. Like it's it just permeates everything. So we almost always include some type of easy to do um, tactic that will help promote the parasympathetic response. So I actually have clients start on this before they even work with me. So as they're waiting for their appointment, we have something that's called the Getting Started Guide. And I tell them, everybody's like wondering, what can I do until we meet? And so I put together this guide that lives on our portal. And I said, read that, watch the videos, start working on this stuff, because if you're not doing it, we're going to be doing it anyway. And so the getting started guide includes cutting out alcohol, reducing, gradually tapering off of coffee, things that are just generally potentially problematic for people across the board. But also, coming back to that parasympathetic response, is chewing your food really, really well, like at least 20 times. And it sounds stupid and it sounds simple, and clients will like roll their eyes. And I say, I know this is going to sound too good to be true, but it works, even if you think it doesn't work. And so they're really like, okay, I'll try it. And they're kind of hesitant, but they try it, and the feedback I get is they are shocked beyond belief that this could help as much as it does. So the chewing helps improve digestive function. It helps promote that parasympathetic response. It basically, obviously, helps break down the food so it's easier to dig. It does so many things. Every client needs to be chewing. And then separately, we have them do some breath work around meal times. Just very simple, like breathe in for 4, breathe out, exhale for 6 count, just to get that like lengthened exhale, which sends a signal to the brain that, okay, it's time to rest and digest. And when clients do this, it really causes a huge shift for them. It helps improve digestion. I know I keep saying that over and over again, but it does. But it also helps them sort of relax around meal times and helps promote that parasympathetic response. And that is huge. So those things really form the basis of the pyramid. And it's going to be different for every client. But then as needed, we sort of escalate up the pyramid. And so for this client in particular, now that we have test results, we now know that there's some H. pylori. We now know that there's some methane overgrowth. And we addressed the H. pylori first, because H. pylori slows motility. H. pylori, can cause reflux and gastritis. H. pylori can cause food sensitivities by, um, eroding that protective mucosal barrier. H. pylori can reduce stomach acid, which then allows for overgrowth of all types of bacteria and critters. So really the first place to start with that information that we just got was to address the H. pylori. And then following that, we addressed the methane overgrowth. So at the end of the day, this client, over a period of months, we took it slow and steady. We did a few things. We addressed the dysbiosis, we'll call it, and we broadened the diet simultaneously. She is now on a much more broad diet. She is now traveling to all sorts of places and eating all the things: healthy, unhealthy, fun foods, high fiber foods, garlic and onions. She's enjoying an adult beverage every now and then. She's having coffee. Like, we've been able to bring back everything. She will reach out to me, even though we're not working together anymore. She'll reach out and say, hey, I went to wherever destination and I could eat all the things. And she's just so thrilled. And now we have check-ins like once every 3 months, because she wants to work on her high cholesterol and she wants to work on preventing dementia. And she wants to check in and say, hey, here's what I'm eating, here's what I'm doing. Like, what else can I optimize? And it's fantastic because she does not have to worry about the GI issues anymore.
Beautiful. Thank you so much for sharing all of that. And now, what is one myth you would like to debunk?
Mm. A consumer facing myth, or like a client facing myth, or a practitioner myth?
Sure, any of them.
Oh, the biggest myth would be that we have to use restrictive diets to get results. And that is what I'm here to debunk. Like, not just through you, but also through, the programs that I'm working on. If we can think through a case, really think through the physiology, the different inputs, if we can improve digestive function, if we can help restore balance, not just microbial balance, but energy balance, mental and spiritual balance, bringing balance back into their lives. They experience some pretty dramatic improvements.
And I personally feel so lucky because being a CNS, I feel we get that very special spot. We do, because we understand the biochemistry of the body. We understand the doctor's side of view of traditional medicine and functional medicine. And then we understand the mind, body, and spirit connection to actually moving the person forward and get to work hand in hand to really marry all of that together. I don't know any other field like it. And it's so cool that we get
Yeah,
to
you
do
bring up
that.
an interesting point because it's not just us. Like, we work as a team. And, I feel like a lot of clinicians feel that it's up to them to solve all the problems for their clients. And this can be a really emotionally heavy and draining practice. It's not up to us. Like, yes, we can help, but we're part of a team. And it's really helpful to have other complementary practitioners that you can refer your clients to and vice versa. So if a client needs therapy, if they need acupuncture, if they need a gastroenterologist, if they need a PCP, if they need like minded practitioners who can all be on the same page and all work together, um, pelvic floor physical therapists. I mean, the list goes on and on. So I just also wanted to mention that it does often require multiple practitioners across different disciplines. Like, it's not just us.
Yep. Yep. Definitely. So if somebody listening is like, wow, I have questions, I want to be a client, how can they find you? Where do they reach out?
Yeah, well, they can look on our website for more information, which is bellyblissnutrition.com. And they are welcome to schedule a call with myself, Stacy, or Ellen to learn more how we can address their case and how we can help.
Beautiful. Thank you again, Sara, for hanging out today and for sharing your knowledge, passion, and expertise. Your trust for your clients, their bodies, and their expertise is so inspiring, and it was really amazing to hear how much Belly Bliss makes a difference for people. Thanks to our listeners for tuning in today for this episode of CNS Unfiltered. For any listeners looking to get in touch with Sara, be sure to check out bellyblissnutrition.com and schedule a call with her or her other practitioners, Stacy or Ellen. If you know something is wrong, trust your body. And please know that a CNS will trust you too. Once again, I'm Jena Salisbury, and remember to listen to your gut.